Hello, I'm Dr. Mike Schmitz, a pediatric anesthesiologist at Arkansas Children's Hospital. Those of us who provide anesthesia to children know the anxiety that parents can have when their child comes for surgery or other medical procedures. It can be very scary to turn the care of one's child over to a group of people who are largely strangers and not even be allowed to remain nearby. The purpose of this video is to show the care involved in the general process for providing anesthesia to children as occurs at a major children's hospital. In doing so, we hope to alleviate any fears or concerns that parents may have. On the day of your child's procedure, you may be asked to arrive before the sun comes up. This time is used to get your child registered and checked by all the medical people who will be caring for your child. This gives you a chance to meet them and ask questions. Some of these people you may have met before, like your surgeon, but others will be new. This also gives your child an opportunity to meet some of them before the procedure begins, making the process less strange. Some of the first things to be done are to get the most up-to-date information. This includes your child's weight, height, blood pressure, heart rate, breathing rate, oxygen saturation, and temperature. We like to be sure children are at their best state of health before their procedure so that they may heal well.
Good morning. Is this Reese? Yes. I'm Dr. Martin from the anesthesia department. Is she taking
The anesthesiologist is the person who will be primarily responsible for the care of your child during the procedure.
Okay.
The anesthesiologist, or one of the anesthesia care providers working with the anesthesiologist, will introduce himself or herself and ask you questions about your child's medical history, including recent illnesses or symptoms. This will help them care for your child during the procedure. They will be interested in medications your child may have, allergies to foods or medicines, and the last time your child had anything to eat or drink. Not eating or drinking before sedation or anesthesia is important because vomiting while someone is semi-conscious or unconscious can be very dangerous.
All right, well, let me take a listen here, okay? I need you to just take some big breaths through your mouth. Can you blow in and out?
The anesthesiologist will perform a brief examination of your child, paying particular attention to your child's mouth, throat, neck flexibility, heart, and lungs. This hands-on contact may also help your child feel safe and cared for. It gives your child a chance to feel more familiar and secure with the anesthesia provider. And we want the anesthesia care to be as smooth as possible.
All right, well, let me tell you a little bit about what we have planned as far as the anesthesia goes.
The anesthesiologist will go over a plan for the anesthesia. This includes the possibilities of your child having some sedation beforehand, where the procedure is located, and how the anesthesia will be given. For example, your child may go to sleep by breathing oxygen and anesthesia gases through a mask, or receiving medicines through an IV. You'll also be told where your child will go after the procedure.
Once she's asleep, that's when you start the IVs?
Yes, after she's asleep. There won't be any needles or IVs or pokes of any sort until after she's asleep.
Since most children hate shots, many can start their anesthesia by breathing through the anesthesia mask rather than having an IV placed first. The anesthesia provider will offer your child a choice of flavored masks, such as bubblegum, cherry, strawberry, or grape. Offering children choices allows them to be part of the process and feel some control. In some instances, one parent may be allowed to go with your child to the procedure area and be there when we start the anesthesia. This is called Parent Present Induction, or PPI. You can ask your anesthesia provider if this option is available. Before getting your written permission for anesthesia, the anesthesiologist will go over the potential side effects and risk of the anesthesia, focusing on the more common side effects like nausea and vomiting or sore throat. Knowing what exactly will happen and what to expect can relieve a lot of anxiety for parents. For children, explaining the same things to them in an age-appropriate fashion also can make them feel more safe. When needed, children are allowed and encouraged to bring a favorite toy or security object with them to the procedure area. Children's hospitals are accustomed to children holding these items until they are under anesthesia, and making sure the items are there when the child awakens from anesthesia. You'll meet the surgeon or the person performing your procedure. He or she will get permission for the procedure if they haven't gotten it at a previous visit. They will also confirm with you what the procedure is and on which side of the body it will be. They will use a marker to initial the location of the surgery. To help relieve any anxiety your child may have about going to the procedure area, often a mild sedative will be given. Many children's hospitals use a short-acting tranquilizer called Versed or midazolam, mixed in a small amount of flavored syrup. Here at Arkansas Children's Hospital, the nurses call it goofy juice, as kids sometimes laugh and giggle after it makes them drowsy. Once your child is relaxed from the pre-med, a nurse will check your child's ID and confirm with you the procedure that your child will have and on which side of the body it will be. If you are participating in the parent-present induction, you may be asked to put on a jumpsuit or change into hospital scrubs. You will also be provided with shoe covers, a hat, and a mask. Then it's time to roll to the procedure area. First, we make sure that everyone is there for your child, and we reconfirm what the procedure is to be done and what part of the body is involved.
This is Reese. She's considered for cystoscopy.
This is called the timeout. It is a safety measure that verifies what is to be done and what equipment and antibiotics may be needed. Then we place all the monitors that we need to provide safe anesthesia. These include ECG leads, the pulse oximeter, and a blood pressure cuff.
Oh, great. Can you stick your chin up at me? Can you stick your chin up at me? There we go.
Is that the bubble
Okay,
gum flavor?
can you smell the bubble gum?
In this case, the anesthesia begins by having the child breathe through the anesthesia mask. Reese has chosen bubblegum flavored air. It contains oxygen and anesthetic gases, like nitrous oxide or laughing gas. Your child may giggle. Gradually, the anesthesia provider adds more potent anesthesia gases. Before reaching stage 3 anesthesia, the level at which surgery can be performed, the child must go from stage 1, or sedation, through stage 2. Stage 2 anesthesia is a light anesthetic during which the child is not fully conscious, but also not yet fully anesthetized. They may wiggle about or try to pull off the mask at this stage. That can be scary for parents the first time they see it, but the anesthesia provider has it under control. Soon the child will become fully anesthetized.
Mom, she's pretty well asleep, so I'm going to have you give her a kiss. I'm going to take the mask off of her face. I'll just hold her chin up. She's doing fine.
The anesthesiologist will tell you when the child is asleep or under anesthesia. Often they'll pause for you to give your child a kiss. Then we have someone help you find your way to the waiting room. For many parents, being with their child until he or she is anesthetized is comforting. Once your child is anesthetized, an IV can be started. To be sure oxygen and anesthesia gases can pass to and from your child's lungs easily, a breathing tube may be placed by the anesthesia provider through your child's mouth into their windpipe. The breathing tube is needed for long procedures and procedures that require the anesthesia provider to take over breathing for your child. In most circumstances, it's removed before your child is awake enough to realize it is there or to even remember it. A surgical drape separates the anesthesia provider from the sterile field of the procedure. Beneath the sterile drape, the anesthesia provider is able to keep an eye on your child. The monitors that were previously attached show the anesthesia provider a steady stream of vital signs. A common misconception is that the anesthesia is provided by one shot of medicine from a syringe that lasts the whole procedure. But the reality is that anesthesia is given continuously and in small increments, providing just enough, but not too much. The pediatric anesthesia provider takes into account your child's weight, age, vital signs, other medications, and overall state of health when designing the anesthetic. This procedure is being performed with the Da Vinci robot, a highly technical device that allows the surgeon to operate by means of probes inserted into small incisions in the child's body. The surgeon is performing the operation by remotely controlling the robot's fine movements. It takes a lot of focused attention. The attention required by the surgeon and surgical assistants for medical procedures and surgeries is why the anesthesia provider is so important. Even during the most complex procedures, the anesthesia provider is always giving primary attention to the well-being of your child. During the surgery, the anesthesia care provider repeatedly checks your child's position. They make sure that the child's head, neck, arms, and legs are in what seems to be comfortable positions, and that nothing is placing unnecessary pressure on any part of the body. The anesthesia provider gives the right amount of anesthesia by knowing the amounts needed for the child's age and weight, and also by careful adjustments based on the monitoring. The anesthesia provider is constantly checking your child and making adjustments to their anesthesia. This is all done by monitoring your child's vital signs and following what's going on with the procedure or operation. An anesthesia provider is always with your child while they are under anesthesia. Providing anesthesia is continuous, constant care. Near the end of surgery, the anesthesia provider reduces the amount of anesthesia. When it's time to awaken, the anesthetics are stopped. The protective tape is removed from the child's eyes. In preparation for removal of the breathing tube, any excess saliva is suctioned from the child's mouth.
Reese, we're all done with your operation. Just start to take some nice, easy breaths. You're doing fine. We're all done. You've done real well today. Reacted a little bit.
When the child is awake enough to open their eyes or make purposeful movements, the breathing tube is removed. Rarely do children remember having a breathing tube. In fact, it is uncommon for them to remember waking up in the operating room after surgery. The anesthesia provider takes the child to the recovery room, often called a post-anesthesia care unit or PACU. A full report is given to the recovery nurse of all that has happened from sedation before surgery to present.
So this is Reese. She is 5.5 years old, 21 kilos. She is thought to be allergic to morphine.
The child's medical history, including other medical problems, other medications, and allergies are mentioned as well. Often after moving to the recovery room, the child sleeps for a while since there is still a small amount of anesthesia that is wearing off. Pain medicine is given if needed to be sure that they remain comfortable. At most children's hospitals, as soon as the anesthesia provider has given all the pertinent information to the recovery room personnel and the child is becoming more awake, the parents are allowed to be with their child. It's comforting for parents to be with their child as the child awakens, and certainly it makes the child feel better and the nurse's job easier. Although Reese is still a bit sleepy, in 20 minutes or so, she'll be sitting up, having a popsicle or some juice. The child's favorite toy or security object is not only allowed in this setting, but encouraged. Children's hospitals know that child-friendly environments help the child feel safe and secure. And when the child is content, so are the parents. We hope that this video has helped you understand the process for providing anesthesia to children as occurs at a major children's hospital. Not just the attention given to safety, but to the overall experience of the child. Our goal is to have children feel safe, well cared for, and very special. And indeed, they are very special. I'm Dr. Mike Schmitz, a pediatric anesthesiologist at Arkansas Children's Hospital.